Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. In today's fast-paced and competitive work environment, it's easy to prioritize profits over people. But the truth is, the well-being of your employees is crucial to the success of your organization. In this episode, Dr. Chris van Straten, the Global Health Advisor at International SOS, speaks about how happy and healthy employees are more productive, more engaged, and more likely to generate profits.
My story is a long one. In some cases got interesting, but I'm basically just a nerd, a super nerd. I studied music first, as a classical, and then I studied jazz at UCT. And I really loved performing and making music. And I think music taught me the importance of connecting with people and that you can connect in so many different ways. Then I studied medicine in Pretoria, University of Pretoria. That was a good 20 plus years ago and got great experience getting amazing training. I spent a lot of time working in townships in around Pretoria, Johannesburg, and also in Cape Town, Khayelitsha. Found that really humbling, but also super empowering in terms of meeting people and really trying to help people with the basic steps that they need to succeed and to be healthy. I've also then spent some time working overseas. I worked on the cruise ships from Los Angeles, sailing down to Mexico, and also ships sailing up from Sydney in the Pacific Isles. And 14 years ago, I joined a company called International SOS. It's a company I still work for, and I'm responsible for clinical governance within the group. And that basically means that daily I'm looking at the kind of cases we're managing in our different projects and sites and making sure that the doctors on our different sites have the right support they need to give the patients the quality care that they need and deserve. I've also got a master's in science from University of Edinburgh in global e-health. And that's really trying to understand the data. Where does one get information? Where do you get data? And how do we interpret that data to really make sure we're giving quality care? So that's my background. So if you want to call me a super nerd, totally fine. Welcome to do it because it's true. In our company in general, what we do is we support other companies in keeping their staff fit and healthy. So I'll give you an example. In South Africa, in Angola, in Mozambique, there are big companies. Some of them have factories. Some of them would have a mine site. And we help them with the medical staffing on those sites and the medical programs to make sure that the people working on those sites are safe and that they are getting the right medical treatment that they need.
I'm literally clapping for you, Dr. Chris, and thank you.
Good. Thanks so much.
Thank you so much for that lovely introduction and just for sharing those lovely highlights about your journey. I guess we can go straight into today's topic. Let's start by unpacking today's key term. Dr. Chris, what's the most comprehensive way to define corporate wellness? What is corporate wellness?
That's a really good question. And it's also going to vary slightly depending on the company and the environment in which that company is operating. But corporate wellness is really that the leaders in the company looking at the different tools that they have to try and make sure that their staff are as fit and as supported as they can be. Because you know what's really interesting? I think of many years ago, I was a junior doctor, 25 years ago. Companies didn't really think about it too much. It was like you get to work, you work hard, and then you go home and that's it. But things have changed and people have realized that if you have fit, healthy, supported staff, there's a really good chance, and the data supports us, that your business will be more fit and healthy and more productive. Because sick people or people who are struggling with mental health issues are probably not going to be as productive. So corporate health does have different definitions depending on who you speak to or which country. But basically, it's the leaders in a company looking at the different tools available to keep their management and their workers fit and healthy.
Dr. Chris, can you share how corporate wellness initiatives can impact employee productivity and job satisfaction?
A big international company started working with them about 3 years ago. They were a European company, but they lay big data cables. They've got operations throughout the world and in many parts of Africa. And several years back, they came to me and they said, Dr. Chris, if you look at the data, in other words, the number of people working on our projects, the different disease patterns of these projects. Is there anything we could do to keep people safe, to keep them more healthy? At that point, I don't know. I needed to see the data. When I started seeing the data, I realized a couple of things. One, a lot of people were getting sick and needing to, let's say, go to a doctor or be hospitalized for conditions that were completely preventable. And I'm going to give you an example. Like if you've got high blood pressure and you don't know you've got high blood pressure. In fact, with high blood pressure, you can feel fine until the point you have your heart attack or your stroke. And then you don't feel fine, but then it's too late. Then you've already had the permanent damage and you might never go back to work. Whereas if you have screening programs, when they're being employed, we check, do they have blood pressure issues? And if they do, we immediately make sure they get to the right specialist to get the correct treatment and then follow them up. In other words, we've been helping these companies with having a clinic at the factory or at the mine site or in the office so that people don't have to take a whole day off or to get to the other side of Johannesburg to go see a doctor. But if you've got a doctor in your office, well, it makes it really quick and easy. And it's amazing. Over a 3-year period, I can't tell you the exact numbers, but I can tell you that it's double-digit number of people who were prevented from having a serious cardiovascular incident like a heart attack or a stroke. And the savings for that client in dollar terms was just under $1 million over a 3-year period. And who wins from that? Everybody wins. So the individuals, you and I, the workers who go to work every day, sit in the office, instead of having to take a whole day off to go see Dr. Canal, just pop downstairs and have my blood pressure checked and then pop back upstairs and get back to my work. I win because my health is being looked after. But the company also wins because it means I'm probably not going to end up having uncontrolled hypertension with the potential dangers of a heart attack. And if I have a heart attack, well, that could put me off for months. That impacts my productivity, my ability to earn, my ability to look after my family, and my ability to be a productive member of my company. What was been exciting is the big European and American companies caught on to this many years back. And I was a bit sad because I didn't see quite the same uptake in South Africa. But increasingly, I'm pretty encouraged by what I've been seeing, not just in South Africa, but in some of the neighboring countries too. Companies, big and small, starting to go, okay, we need to look at how we can keep people fit and healthy. So that's one example. And blood pressure is just one of the diseases, but things like diabetes, hypertension, if you can access screening, monitoring, and support at the workplace, you can actually make quite a big difference to quite a lot of people.
I know you just touched on it a bit, but can you just walk us through some of the most significant benefits of prioritizing employee well-being? How can prioritizing corporate wellness be beneficial for workers?
What we normally do when we structure these programs is it's about educating people and empowering people. So we have multiple sessions in our own company, but also for our clients to say, okay, every month there's a presentation on an important wellness topic. So it will be things like ergonomics. How are you sitting? Where's your computer? Is it going to be good for your posture, your spine? What are you eating? What's in the canteen? Is it good, healthy food? Or is it food that maybe is not so good for you? So the first thing would be educating. The other aspect too is measuring, giving people an opportunity to access screening. And then there are different measures depending on the company. Some of the companies I've worked with too, they have, for example, an exercise either facility within the office or supporting staff in being able to access a local gym. Then the other really important part for me too is making sure that there's health insurance or financial education that's part of the package. Because to be holistically fit and healthy is not just about making sure that my blood pressure is right and that I'm eating good food and that I'm getting enough exercise. It's also about making sure that there are other tools that I need in life to be successful. Well, to eat well, you need to be able to afford it. So financial training is also should be part of that package. And the other part too that really pleased has become more in the forefront is mental health. When I was a young man, my grandparents, you couldn't talk about mental health. You couldn't talk about sex and you couldn't talk about mental health that men didn't cry, right? Well, I don't think it's perfect, but I think we're in a space now where it's increasingly easier for people and people at work to be able to say, hey, I might be taking strain with a particular topic, and making sure that the workspace there are either escalation triggers or ability to speak to your managers, and making sure the managers are trained to be able to do what we call psychological first aid. And that's saying, okay, is this something that needs a listening ear, or does it need more than that? Do I need to be able to refer this person to a psychologist or specialist care, but not ignoring it, not just pretending it doesn't exist, because that will later become a bigger issue for the individual, but also the business. So a full package of thinking about implementing corporate health. You need to know what your context is and maybe what you're measuring, and then tailor the support, but it's usually within those parameters of physical health, monitoring, tracking, following up, ease of access, psychological support, and then also incorporating financial health and training, because it's a big part of the bigger picture.
What would you say are some small changes that people can personally make to improve their well-being at work?
Oh, that's a great question. The first one I'm going to say, it's more because of my own experience, and it will differ from person to person. I'm a technology geek. I love computers. I love the fact that, Candace, I don't know where you're sitting, but I'm in Pretoria and we're having a work call and it's good. Many years back, geeks like me were saying, hey, we must do telemedicine, or why can't we do work from home? And not every day, but be able to work from home. And now we're in an age, the pandemic really spurred it on, where we can do that. And I think it's important because my needs physically and mentally and psychologically are different. I'm most productive when I'm in a quiet, focused space. So when I go to the office, I struggle to focus because I'm just surrounded by people I want to talk to. Right. So when I want to brainstorm or I want to, be creative or network, then I go to the office. But when I want to get something done, so if I need to write a policy and procedure, or I need to analyze data, I would much rather be at home in a quiet, focused space without any disruption, and I can work straight for an hour or two, as long as it takes to get it done. So I think step number one, you'll hear a lot of corporates speaking about this, a lot of business channels too, about being able to incorporate this hybrid model of working, I think is really important. One size does not fit all. I know there's a big focus on return to work, and I get why that's important in some businesses. But in other businesses, it's been shown that flexibility and hybrid can have a big impact on the productivity and the mental health well-being and physical well-being of people. That's one that rates really high in my list. Step number two, we are what we eat. I'm thinking back in the pandemic 2-3 years ago, I was super stressed. I was binge eating speckled egg chocolates and my waist grew very quickly, right? And I wasn't exercising because I was always working, and I don't think it helped. I wasn't eating well. I wasn't exercising. I don't think it did me physically good, and I don't think it did my mental health any good. So it's getting back to the basics. You are what you eat. So it's important, fresh fruit, fresh vegetables, reduce the amount of super processed foods that you consume, and make sure you're getting exercise. And in fact, it's a habit that I'm still doing, and I think is part of my success is it doesn't matter if I'm in the office, it doesn't matter if I'm traveling 2 or 3 times a day, I stop for 30 minutes and I go and exercise. And if I'm in the office and there's no gym, well, then I'm going to walk 3 kilometers around the building, whatever, to make sure I'm getting in those steps and I'm getting my circulation going and I'm getting my brain going. And there's so much data to prove that and show that daily exercise is critical to your mental and physical well-being. So those two are very top. And then the mental health in terms of relationships, making sure you build your relationships, whether that's partners at work, your mentors at work, your home relationships. And to ask for help is not bad. It's a sign of strength. And reaching out for psychological support, it's the right thing to do. It can literally save a life. And being that for other people, or when you need help, to have the strength to reach out. I think we really do need to emphasize it more. I think in some parts of South Africa, we're an amazing nation. We're incredibly resilient, and we've done such amazing things. But we can get caught up, I think, in a lot of our negative talk. And I understand that. But I do think we also need to focus on what's good. And we do need to be able to put up our hand and ask for help and not be ashamed of doing that.
Dr. Chris, thank you so much. I know you just mentioned some very beneficial aspects, but just to wrap things up, what are some closing thoughts or key pieces of advice you can offer to listeners to create a healthier, more fulfilling work environment for themselves?
So one, educate. Information is power. And it's a cliche, but I think it's a cliche that's true. There are amazing resources available. on the internet. There's also some very poor information. So be thoughtful about what you follow. But there is good information, and partnering with the right people can make such a big difference. In my own life partner, my wife, she's been such an amazing support in my ups and downs, and vice versa. Being able to reach out to professional support if you have healthcare challenges, whether that's your local GP or doctor or specialist care or psychological support, and all big corporate companies, they do. I think what happened many years back, some companies thought, well, we're going to start a small little wellness program, but they never thought it through. To be successful, you need to be able to measure something, implement a change, and then measure, did it actually work? And some of the programs I've looked at, they didn't really establish that methodology. But the companies that have been very successful in building these programs and have been able to measure it and see the increased wellness of their staff and the return on investment financially, those are the companies that have truly succeeded and put themselves ahead of some of their competitors. To summarize that, it's being prepared to reach out and to partner or build those, find the right support system, and it can have very big positive consequences. Thanks so much, Candice.
Thank you for joining this week's episode of the Health from Zanzi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Zanzi podcast, and your ears are always invited. Corporate wellness isn't just about offering gym memberships or discounted fitness trackers, but also about creating a culture of well-being that empowers employees to prioritize their physical and mental health for a healthier work environment. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.